That's my job, provide that access.
Well, we appreciate you coming along. Thanks a
Thank
lot.
you, sir.
Thank you. And don't forget to ask about the Pugleasa,
That's right.
the greater Bemidji area that'll guide our development into the future.
Members, county commissioners, they're appointed by their respective bodies.
Honey, or it can be local, you and I creating a business that then we take to a local perspective.
If you have a question, call and ask, we'll help you.
Nobody knows about it, and it's
Well, the
great
word's out now. Word's out now.
Your entire operation, how to bring people in. So let's get involved. Economic development is one of the most important tasks we have.
It is. It is.
Great to hear about.
Thanks again.
Mr. President.
Thanks, Steve. Thanks, Steve.
It's been a pleasure, Louis.
Good evening. It's 6:30 on Wednesday evening. I'm Lou Crenshaw, and thanks to Upstream TV, we're back once again with Inside Bemidji, where we showcase people and organizations who are working to make our community an even better place. Tonight, I'm pleased to have John Pugleasa here with me, the Economic Assistance Division Director of the Beltrami County Health and Human Services. And so we're going to be talking about county services this evening with John. And John, thanks for coming.
Thank you.
And well, let's start with you, John. Are you originally from Bemidji?
I'm not. I grew up in central Wisconsin. My family moved to northeastern Minnesota when I was in junior high. And so I graduated from a small town on the Iron Range.
Okay, okay.
And then lived in the Twin Cities after I graduated from college down there, and lived there for about 12 years. And my family and I have lived here for just about 20 years now.
So you were in the cities 12 years after you graduated. So you went to college in the cities.
Yeah,
And
actually,
then stuck around for quite a
Yeah.
long time, huh?
yeah.
Did you
12
start your
years
family
including
down
college.
there? Oh,
Yes,
okay.
yes.
Yeah.
Yeah.
And your wife is from?
My wife is originally from the Twin Cities area, and she's a nurse at Sanford.
Okay,
So
great.
she was a nurse in the Twin Cities, and we have 4 children.
Okay.
My youngest is graduating here in a couple of days from high school, and so I've got 3 daughters who have graduated from college, and
Okay, good for you.
2 weddings this summer. So
Oh, you're a busy family guy.
busy guy.
How's your wife adjusted to Bemidji?
She's really enjoyed it.
Good.
You know, Bemidji is our home.
Good. Yeah, Bemidji's my home. I live here because I love it. So, well, that's great. When you came to Bemidji, you came to do what job?
I came to be the assistant director at Timber Bay House.
Timber Bay House. Don't know it. Is it still here?
It is. It's an organization that works with at-risk youth. So my
where
background.
are they located?
They've moved, and they're actually across from the high school.
Okay, Timber Bay House. All
Yeah.
right, we'll look that up. And what year was that?
1993,
All right. So,
summer of '93.
all right. Well, that's a good time to move to Bemidji.
Yeah, yeah. I want to come here during the snow.
No, you could really shock the wife with that. So you worked with Timber Bay House and stayed in Bemidji. What other jobs did you move through as you made a home here?
After I left Timber Bay, I taught for a year with the Bemidji schools, and then I took a position as the executive director of the Beltrami Area Service Collaborative, and I worked there for just about 12 years.
But Beltrami Area Service Collaborative.
Correct.
What kind of group is that?
They work with trying to coordinate and collaborate services between school districts in Beltrami County, between county services and nonprofit services, primarily with the beneficiaries being children and families.
All right, so there's a theme of working with social services that brought you into the county job.
Correct, correct.
I see that, and education. Now you just told me a little while ago you're on the school board as well. Right?
I am, yes.
Okay.
I'm currently first year of my 3rd term.
And how many years is that?
That would be 9 years.
No, good for you. Good for you. And that's a volunteer job?
For the most part, we do get a small stipend,
Uh-huh.
but it's, I don't like
Pays
trying
your
to,
gas?
yeah, I don't like trying to figure out the hourly on it. It's a little
Yeah.
discouraging.
Okay, okay. So how did you move then into this county position?
I was asked to apply. I think the county was going through a transition to developing a health and human services department, and the director, Mary Marshall, asked me if I was interested in looking at some opportunities there, and I did, and so I've been there for about 4.5 years.
Good. And 4.5 years, good. And so this was this the period when they put together the Health and Human Services or
They had-
reorganized?
Yeah,
or-
they had merged Health and Human Services probably about 6 months prior to my starting there. So, you know, they're probably about 5.5 years ago.
Okay. So for those of us who don't understand this, let's move into that a little bit. So about 6 years ago, the county put together the Health and the Human Services into one organization, now run by Mary Marshall.
Correct.
And we'll get to the pieces of it later, but let's start by why do they do that and what benefits does it bring us?
Well, I think that there's a lot of synergy between health, public health programs, community health programs, and human services programs. And so by having one combined health and human services division or department, we hope to maximize those things. So we're working more in a coordinated fashion between our public health nurses, our social workers, our economic assistance staff. As constituents interact with the county, they kind of assume that we know what each other are doing. And so it gives us the opportunity to kind of have more cohesion to what we're doing. There's some economic benefits as well. And
This kind of idea of sharing resources
Right.
and that sort of thing, leveraging. And I used to call that word's probably gone out of vogue, but years ago when I was in business, we'd like to talk about leveraging. Yeah, but I guess then the implication must be that the human services have a big health component, and that what we provide is healthcare is integral to it.
yeah, you know, I think that there's not a clear distinction between where different types of public health programming and social services, kind of where they interchange. A lot of times people are interacting with our public health staff as well as our social services staff, as well as our economic assistance staff. And so by us being able to have more of a coordinated approach to that, hopefully that provides a better service.
Okay, so this group, if you will, that Mary has, this Health and Human Services Group, now they're located here in downtown Bemidji in the county complex, if you will?
Yeah, our main office is in the Community Service Center, 616 America.
Community Service Center, 616 America.
There you
See,
go.
I didn't know that.
Yeah.
Now we know that, which is down here near the courthouse, right
Correct,
downtown.
correct.
And what's your organization like in this 616 location?
Well, we have offices on parts of 3 floors. We've got some of our public health staff right on the first floor. We've got some of our economic assistance staff, and
Public health staff, economic assistance staff, okay.
those folks are on second floor. And we have some of our social services staff and children and adult services staff on third floor, and then administration on third floor.
Okay. So it's a fairly good-sized operation right here in downtown Bemidji.
Yeah, I think we've got about 137 employees, something
Wow.
like that.
So that's a very good-sized operation. And let's talk about the pieces then. So I was on your webpage, so
Okay.
let me start and see if I
Good.
got it right.
Good.
So there's 3 pieces, main pieces, there might be others, but the 3 main pieces that serve, if you will, the public are social services, adult services, and children's services. Anyway, social services is one, and then economic assistance, and then public health.
Correct.
So, social services, economic assistance, and public health. And of course, John is the Economic Assistance Division Director, so you're the director of one of those three.
One of those divisions, correct.
But we're going to pick on him and get him to explain the others to us anyway, since we got him here.
Well, I'll take a run at it.
Good. Well, we'll familiarize me and others with just what goes on. So, if you don't mind, then, John, seriously, we'll start with social services.
Social services tends to be a combination of children's and adult services. Children's services could be anything from what people would imagine as traditional child protection services, to children's mental health services, children's welfare, different types of things that have to do with.
And interrupting you because is that the overriding philosophy here, children's welfare? You probably
Yeah, for
meant it
children's
as a
services.
specific
Yeah.
program.
Yeah.
But when you talk about children's services, which is part of social services, what kind of philosophy are they following, and what are they trying to do?
Well, I think we want to maximize the health and well-being of children. And so that could be anything from making sure that children with disabilities have the support and the assistance they need to maximize their abilities, to
Good.
making sure that children who are in vulnerable situations or in dangerous situations, that we do our best to protect them. And children who have more chronic kinds of things, developmental disabilities, that we provide certain supports to them and their families. So those are kind of the basic idea around children's services.
Great. Laudable. Now, how do you decide that a child needs protection, or the family? How does a...
Well, each of those programs has different ways to access the services.
All right, let's take one for example. Let's talk about child protection, okay? Maybe that's not a good one to start with, but if you don't mind, let's...
Child protection tends to be, those cases would be started with a report to county intake, and then we have our staff investigate that and determine whether a case is warranted.
Whether it's real or...
Right.
And to how egregious it is, I
Correct.
suppose.
In most cases, we provide supportive services or referral to those families to help address some of the challenges they may be facing. Anything from parenting services to different kinds of respite services to give folks a break. Sometimes it's looking at different addiction types of things and addressing some types of treatment for adults in the home. Sometimes we open a child protection case because we need to get on it and provide the protection for the child, because the situation, based on the investigation, is dangerous for the child.
Yeah. But it sounds like, from what you've just said, there's a lot of flexibility so that a particular situation can be addressed in a number of different ways, and therefore hopefully the most appropriate way, right?
Our preference is to keep families unified,
Okay.
and to stabilize families and not to break families up. And in most cases, we're able to achieve that. In some cases, that's not able to happen based on
The situation is just
circumstances.
too far gone, or...
Right.
Uh-huh.
Again, our bottom
again,
line is the kids' welfare.
Yeah, good point. So, first of all, is to try to keep not first of all, you intend, if you can, to keep the family together and functioning, but as a last resort, the child's protection is the most important thing.
Right.
The child's welfare, I don't know exactly what word you said.
Right. And, sometimes that means that children are placed in out-of-home placement to be able to protect them from the situation. In many of those cases, there are interventions that are done with the family to, all with the intent of reunifying and bringing health back to the family.
Okay. Children's services, and then again, under social services, we got children's services and adult services. So we've been talking about children. So let's talk about some adult programs, just to understand.
Maybe just to
them.
back up a little bit.
Sure,
our
go ahead.
children's services aren't just child protection. There's also children's mental health services, working with children with developmental disabilities and those kinds of things that have nothing to do with abusive situations or whatever, but it's programs that are designed to support families with children that have specific challenges.
Yes, you know what, I'm really glad you did that, because I had talked about child protection and then went on and I've acted like that was the program. But there's children's mental health services, there's family preservation services, which you were talking about. I got this off the webpage. Well, look at their webpage. The county has a lot of interesting things on it. There's foster care licensing and adoptions. So you're involved in adoptions as well?
Correct. You know, foster care licensing, you know, out-of-home placement, again, back as one outcome of a child protection case. We license those foster care facilities or homes.
Okay. So here in Bemidji, then, do we have some of these?
Yes.
Okay, so in Bemidji, we have a foster care home, and the family situation.
You could have one.
Well, now we'll talk about that later. So the family situation is so bad, the child has to be protected, so the child goes to a foster care home, and you guys have vetted it and licensed it.
Correct.
And, okay, got it. Good, good. And there was also parent support outreach.
All of those are things that are kind of along that spectrum of child protection to be able to provide different kinds of supports and assistance to families that are struggling, and hopefully in a temporary manner, and providing some sort of assistance and support to them, and again with hope that they return to health. And again, the bottom line is the welfare of the children.
Good. And I really like the flexibility to deal with every situation. You've
Right.
got a lot of ways you can deal with it. So then, now, adult services?
Now we can talk about adult services.
Okay, good. Nice catch.
Yeah. Adult services tend to be, a lot of those cases are, start off as children's cases. They maybe are adults that have disabilities, developmental disabilities, different things like that. Adult mental health services, and those are services that are intended to provide supports to those adults to keep them in the least restrictive environment. Keep them.
So understanding what you said, John, so you might have someone in the children's mental health services, and then they grow up, so now they must transition to the adult mental health kind of.
Sometimes they do. Sometimes, you know, sometimes we're able to address some of those issues, and they don't transition to the adult mental health. You know, probably more would be like developmental disabilities. We may work with a child who has a developmental disability.
Okay,
And
right,
then as
right,
they
right.
grow up, they become an adult with developmental disability. And you know, again, our main hope there is to be able to provide some level of independent living and assistance for that. And sometimes that takes a little bit of case management.
And meaning, if you, case management says to me, let's make sure I understood, that every case you might provide a different kind of support.
Exactly.
Depending on what's needed.
It's what is sometimes referred to as like a wraparound service. You take the services and supports that are unique to the situation that the individual has, and try not to have a situation where it's a one size fits all. And you know, each individual has their set of certain challenges and skills and strengths that we want to be able to maximize. And so that's a lot of the adult services that are provided there.
So once again, I'm hearing this theme of real flexibility, kind of support. You know, I'm making this up, John, but I can see, okay, I can live by myself and I can clean up for myself, but you don't want me like running a gas stove and forgetting that it's on. So maybe you provide that kind of help, food or something, but
Yeah,
leave me
depending-
alone for the rest of it, or?
You know, it depends on how a person comes into those kinds of programs, and you know, we're always looking for the least restrictive environment, but we want people to be safe. And you know, there's a continuum there where there's people who are vulnerable adults, and sometimes those people are taken advantage of, or they're they're in situations that aren't in their best interest, and we want to make sure that as a
I
community,
hadn't thought of that, but,
Yeah,
well, that's a whole nother aspect of it, isn't
right,
it?
and so a lot of that adult services is intended to provide those assistance and support so that people can be independent as possible.
Yeah, I hadn't thought of that aspect. See, I was thinking of, like it says, support, but there's a protection aspect, just like the child program
Right.
as well.
Right,
Okay, I didn't appreciate that.
and so,
Not
there's-
just protect from yourself, but here you are out in society trying to live alone and,
right.
okay.
Unfortunately, sometimes people will take advantage of a vulnerable adult, and so we want to be able to provide some level of support there.
Great,
So,
got it. Good for you. Good for you. I want to kind of go down the list because on child services we didn't. So when we talk about adult services, let's go down the list just a little bit. Maybe some of them will be okay. Alcohol and drug addiction. Now, how does that? Do people walk in the front door, or do they come through the courts, or
some do, but I would guess most of them come through different court types of action, either things like DWI, or in some
Yeah, okay.
cases through our child protection services, or through CHIPS court, where the judge determines that the family has some issues with addiction.
Oh,
And-
so that could be like the root cause of the
Right,
child
so-
problems, if you will.
So as the judge and the court is trying to reunify the family and bring health back to the family, part of that may be that they order that one of the adults in the home needs to get an assessment and potentially get some treatment for those things.
And who does that treatment?
There are a lot of different vendors who will provide
So we
alcohol
have those
treatment.
people here in Bemidji? I mean, the county doesn't do that.
The
Those
county
are-
doesn't provide that
okay.
service.
Okay,
Those
I'm
are
just trying to
vendor
understand what the
services.
county does. So you guys really do, in this case, more of the assessment and the recommendations?
Right.
Gotcha, okay.
And in many cases, then those folks would come through the county because they're accessing public funds for paying for those treatment services.
So the county will pay for them if they can't?
Correct.
Okay, and
It's-
you guys make that
Under-
assessment as well?
Under certain circumstances, obviously if the court is ordering or recommending that, those kinds of things.
Okay. And that court would be, this is a question, I'm just thinking out loud, that court would be right here in downtown Bemidji at the
Yeah,
courthouse?
district court.
The district court,
Mhm.
okay. We've talked about services, we're talking about adult services, I'll remind you here, we're talking about social services, and it's got two sides, children's services and adults, so we're talking about adult services. We've talked about persons with developmental disabilities, and now services to the elderly and maybe physically disabled adults and children.
Similar kind of thing, to
Similar, right?
provide, and that's one of the areas where we really see a lot of value with coordination of our efforts with public health and providing services to elderly or adults with disabilities and helping them live as independent life as possible. It's a more economical way to do that. Plus, I think most people,
To keep them in their home?
yeah, as opposed to institutions, nursing homes or hospitalization, those kinds of things, and
Because those, as you point out, are way more expensive.
way more expensive.
So as long as you can support a little and keep that person stable in their home, that's better for everybody.
Right, and I think most of the people we work with would significantly prefer to stay in their home.
Everybody I've ever seen
Right,
wants to stay in their home.
right.
So if you want to stay in your home, there's support out there to help you. How does a person get involved, to say, again, can you walk in the door? You don't need the court to tell
Some of that
us
is,
to-
I think, connected to health services through the hospital, through the clinic, and our
okay.
coordination there. Both children's services and adult services, I don't work in a daily
I know
basis.
that.
and so,
I said this earlier, maybe you missed it, you know, I've got John talking about things he doesn't do on a daily basis, but you're
Yeah.
doing a great job of explaining the kind of services we have.
Yeah.
Last one here, because we've talked about licensing of facilities. What are adult protection services? That just jumped out at me because of the title, you know, it's just me wanting to know, what's an adult protection service?
Sometimes there's situations, like I mentioned, as far as vulnerable adults. You know, anything from, you know, people who are exploiting vulnerable adults, or sometimes you hear about situations where there's hoarding or there's unsanitary situations in their home.
Somebody needs to be protected from themselves. in
From
some
themselves
way.
or from people who maybe would be exploiting them.
Okay, so this is people who are in some way vulnerable. This
Correct.
is not, you know, my ex-boyfriend is stalking me and I need to do something about it.
Right.
That's a different thing. That's
Yeah.
a police issue.
Correct.
Got it. Okay, got it. Well, we've been talking about social services, and I want to go on to talk about economic assistance. But first, I'm going to take a little break here, okay?
Okay.
So, thanks for joining us tonight. I'm Lou Crenshaw, and thanks to Upstream TV, we're here talking inside Bemidji. We're with John Pugleasa, who's the Economic Assistance Division Director at the Beltrami County Health and Human Services, and we're talking about the services and how it works here in Bemidji, in Beltrami County, and thanks for joining us. We're going to be doing this for another half hour or so, and I hope you find it interesting and stick with us and maybe see us next Wednesday evening. So, John, I wanted to say we're going to go on to economic assistance, which is your division, but let's understand, I'd like to understand, where does the funding come from? How does this work? Here we are, Beltrami County, you got 130, I got the number wrong, whatever people, but something like that down there, doing these good things for children and adults and making our county a better place. How's the money work?
Well, each program, and there's many different programs, you know, we've broken it up into 3 large divisions, and each of those divisions have different funding sources. Many of them are state or federally funded, or portions of the service are state or federally funded. Oftentimes there's local effort, and so that's some of those costs are borne by the local taxpayers.
So the majority, though, comes from the feds or the state?
Depending on the program. In economic assistance, the direct assistance that goes to individuals comes from the state or federal government.
Okay.
The cost for having staff to determine their eligibility is about a 50-50 split between the state and the local taxpayer.
Okay.
So that's, you know, one example. Then there's different reimbursements that the county receives for different services they provide that are all over the map for different kinds of service. Some have higher or lower percentages of local effort. Most have some billable services or services that we're reimbursed for.
So you say there is a lot of, and I don't remember your word, like programs that are funded, initiatives, I don't know, for each of these areas?
Well, you know, as we mentioned with children and adult services, there's different kinds of services. So we tend to specialize our services. If there's somebody who's worked for years with an adult population, they get good at that. And our program is designed around that. It's funded through different legislation, statutes at a state or federal level that govern that work. And then there's funding mechanisms that help offset the costs of that. Same thing with children's services, and there's a variety of those different kinds of services.
Now you turned that around to me in a surprising way, because you talked about something that we do and then we seek funding for it, whereas I had it in my mind that the federal government had an initiative around childs and we were, if you will, implementing it. So does it work both ways?
Yeah,
or?
there's different ways to look at that as well, and you know, Minnesota is a state that counties administer the social service programs.
Say that again, I'm sorry.
Minnesota
Is a state where the counties
administer the social service programs in
of
many
the state.
of the state. In-
So the state funds a social service program and we administer it, we implement it?
Well, it's a partnership. And that's what I'm saying, with different kinds of programs, and it's, I'm gonna get into some areas that it's.
Well, it's just that I'm
Yeah.
trying to understand, I can see now that the federal and the state are supplying the bulk of the funding, but it varies from which
Right.
program.
Some
where it's
states,
coming
for
from.
example, maybe have a state Department of Human Services office that would be in a community like Bemidji.
Uh-huh.
And so those are state employees, and their programs are administered by state employees.
Yeah, I came from Delaware, or I didn't come from it, but I lived there for a long time. They only got 3 counties, so I would imagine
Yeah.
they just have a state
Yeah,
social service.
and many states do have, just like we have state DNR offices.
Yep.
We don't have a county DNR office.
Mhm,
The
okay.
state operates and administers.
And it just
its-
has these, if you will.
Satellite offices all
satellite
over the
offices. Okay.
However, as it relates to human services, those programs are administered at a county level, and it's a partnership between the state and county government. So the funding.
Just thinking about that, John, you talked already about how you have the flexibility to, if you will, tailor the support situation by situation.
Mhm.
Well, then if the county is taking the lead on administering, that sounds like a good thing, because you're close to.
There's definitely some good sides to it.
Mhm.
Some people would argue that since some of the monetary responsibility is the county's responsibility, it relies heavily on property tax as opposed to state taxes. And so, different states operate differently, and that whole issue of more local effort versus state or federal effort is one that is debated annually at the
So
state.
we have property taxes going into this as well.
Right,
Okay, I guess I didn't appreciate that.
yeah.
Yeah, okay.
So, in economic assistance, the actual dollar assistance or medical assistance or food support, those are paid, all of that is pass-through dollars, that many of those dollars originate at a federal level, come through the state and go through the county. But the cost of us having staff to determine eligibility for those programs, that's borne 50-50 by the state and the local effort. And so, it's just different states do it differently.
Gotcha.
And that's, like I said, it's something that's kind of hotly debated at every legislative session as to what level of support the local effort should be and what should be the state or the federal support.
But I guess the bottom line is, yes, we're spending something here, but there's a lot of federal and state money
Correct,
available for social services type programs.
correct.
And economic assistance. Finally, I'll get you off talking about other people's work. Let's talk about economic assistance. What do you guys, what's your organization like, and what kind of things are you involved in?
Well, economic assistance kind of takes there's two big parts to it. There's the actual economic assistance or public assistance kinds of programs, anything from cash assistance, food support, medical assistance, those kinds of things. And the other piece is child support enforcement. The idea is if you're going to come and ask for public assistance, we establish a child support case adjacent to that. Because if there's a single parent family or there's absent parents, we should try and get assistance for their children or for their families before we go to the public taxpayer. And so the child support enforcement goes hand in hand with the public assistance programs.
Well, what is an example? What does that mean, child support enforcement?
Well, say,
Like,
I mentioned
I've
earlier-
got 3 children, but I decided to go live across town, and
Right.
and I don't give them any money, even though I'm working. Is that a
Right,
you-
so
you
then,
get a hold of me
your
and-
children or your wife and your children show up at the public assistance office because they need some sort of assistance to be able to support their livelihood.
Right.
And so what we would do is we'd say, okay, where's Lou?
Yeah, right. You go to the
Um,
courts and make sure that
And
I
that's the child support.
step up to my responsibilities.
Now, if you have no means of income, then that kind of leads to a
Different
a
situation.
public assistance case. But first we look to you and say, okay, these are your children, this is your family. True, you don't live with them, but they're your responsibility.
Right.
And so then there are a variety of different remedies that we do through our Child Support Enforcement Office to encourage you to help support your family.
Is that example, are there others of enforcement, other kinds of situations, or is that the most common
That's one of the
kind?
most common kinds, and and then there's just a number of different ways through garnishing of wages, through holding professional licenses. There's just a variety of different remedies that our Child Support Enforcement Office encouragements to say, take responsibility for your children.
Yeah.
It shouldn't be the taxpayer's responsibility to care for your children. So those efforts are an important component of public assistance. And a lot of times people think about welfare or public assistance and they don't realize that those efforts are occurring too.
So the first step in the child situation is enforcement. And if that fails, then you move on to assistance?
Well, as part of our determination of eligibility for public assistance, we want to determine whether there's absent parents or people who have responsibility for the family. That's part of our determination of their eligibility for those public assistance funds. Then it's based on their income, their assets, household composition, children with disabilities. There's a variety of other things, but primarily income and asset eligibility.
Right. In other words, they gotta really need the assistance.
Right, and those are
There's nobody else, we talked about enforcement, there's nobody else.
right.
And so, okay, we gotta step up with assistance. So now you're talking about criteria for deciding who qualifies.
Right, and that's all driven by state statute and policy. So at our
Really?
state, yeah.
So
at our
the state has laws around
right.
the criteria.
We don't just decide in Beltrami County. We're going to be a little more difficult than they are in Clearwater County.
All right.
It's all driven by state statute and policy, and so our job with economic assistance is to determine eligibility based on those categorical
So
programs.
you've got the criteria given to you.
Correct.
And you just make a determination on those criteria and the outcome is the outcome.
Correct.
And supposedly, not supposedly, but under this system then, Clearwater County, in which we would have the same.
Right.
So we don't have people rushing across the border.
Right. A case in Clearwater, a case in Cass, a case in Beltrami, they should all be relatively the same. Because those resources that support that public assistance, they're pass-through dollars. They're not, the county isn't paying for that out of property tax or local effort. But the job of determining those individuals' eligibility for those programs, that's what's done at a local level.
Okay, so the federal money, if there is some, and the state money, if there is some, pass through the state, they write the criteria and they pay. And
Right.
so it's fair that they write the criteria, because
Right.
they're the ones paying.
Right.
Now you, John, you talked about child support, is economic assistance in the county mainly child-centered?
Well, there's,
Or are there other kinds of assistance
no,
as well?
there's, I don't know, there's different types of assistance that go to families or to people with children, and some that go to single adults. What is sometimes misunderstood, if you look at public assistance, there's, I don't know, we've got in the neighborhood of 7,000 to 7,200 open cases. The vast majority of those cases are medical assistance. They're
So you have, and this is Beltrami County, you have order of magnitude 7,000 cases, and most of them are medical assistance.
Yeah, they far and away, most of those cases are medical assistance. They're people who don't have healthcare insurance, and so they receive medical support from medical assistance or different programs like that, based again on their income and
Ability to pay.
right.
So is it preemptive, or is it when they get sick? In other words, do you take health care on for them, or is it when they
Both.
run into trouble?
Sometimes it's when somebody shows up at the hospital or something, then then they'll apply for medical assistance because they're not able to meet the obligations of those bills and they don't have a payer. A lot of times the provider will initiate that application because they are looking to be paid too. And
So the provider provides the service, looks around for who's gonna pay.
right, when you sit down and
And-
it's like, okay, give me your insurance card, and you don't
yeah.
have one.
Right.
Oftentimes the provider will initiate that medical assistance application so that that can establish a data service and their services could be potentially covered by medical assistance.
So, you're interacting then with the healthcare community quite a lot if you got 7,000 cases that are involved in medical.
Well, they're not all involved in medical, but the largest portion. You know, a lot of times people think of public assistance and they think of it as cash assistance, check in the mail kind of thing.
Is
Probably-
this, is this the food assistance as well?
Yeah.
So that's in there.
Yeah, all public assistance, food support, medical assistance, cash assistance, that all makes up that number of around.
But the
7.
cash assistance you're saying, if I heard you right, is a minority.
Yeah, I'd say in the neighborhood of, I don't know, 12 to 15% of
Oh,
our
that's pretty
cases
low.
are cash assistance. And a lot of times people forget too that it's a time-limited program. And people have specific requirements that they have to meet to be able to continue to receive that. They need to be doing
This
work
is cash
search.
assistance.
Correct.
Okay.
They need to be looking for work or working.
Either working or looking for work.
Right. And in the state of Minnesota, you have 60 months of that cash assistance, and that's lifetime. So-
60 months over your lifetime.
Correct. And so if you use 24 months of that,
Okay.
then you've only got 36 months left.
When, when someone, and you do say it's a small percentage of economic assistance, but when you are paying somebody cash, do you stipulate in your agreement or whatever you do, what that cash can be used for? In other words, is used only for rent or only for food or only for whatever? I don't know.
In some cases, we'll do vendored payments to be able to make sure that, and in some programs to be able to make sure that rent is paid for, or utilities, those kinds of things. Some it's cash assistance and the person decides how they use that. There are different stipulations, again, that come from state legislation as to whether you can use those benefits in other states or different types of things. And part of our economic assistance program also is fraud prevention and fraud investigation, because some people choose to abuse these programs. And so we have some of our staff who look to that and investigate and determine whether, you know, errors have been made or whether there's been willful program violations, those kinds of things.
Is that like a moving target? In other words, the ways people would abuse it evolve and change?
Sure,
Yeah.
sure.
You know, the reason I ask you that is a total aside, but just while we have a minute here. My son works for a big credit card company.
Mhm.
Now, I always, in the downturn, the economic downturn, I always ask him, couldn't I tell people you sell used cars? Because I don't want to tell them you're a credit card banker. But anyway, at one point in his career, he was working with their fraud protection,
Mhm.
which, as you can imagine, in credit cards is a big deal. And he said something to me once that I had never considered, and he said that fraud learns. And I said, what do you mean by that? And he says, well, they learn over time what works and what doesn't work, and they're always changing what they're doing. And so that's why I asked you that question. I just wondered if you encountered that as well.
I would say definitely that, but I also see a fair amount of people who just are not, well, I shouldn't say a fair amount of our fraud cases, which is a small portion of our cases. But I see a fair amount of those fraud cases where people just are not truthful on an application.
Yeah.
They're not truthful about the number of people in their house or where they're living, or they don't disclose all of their income, and we find that out fairly readily and make sure that that's corrected.
Well, the best thing you said is it's a very small percentage, so we'll move off of that. And we'll go back and do a little look at the top again, John, on economic assistance. We talked about, I think it's got child care assistance.
Child care assistance is providing child care for people who are working, and again, it's an income and asset-driven program.
So this is, if you will, simplicity, daycare.
Correct.
I need to work, but I can't, I'm a single working parent. And
Right. So you've got young children, and you can't care for your children and work.
Right.
And so,
Right. How does someone enter into that program? They go to the county office and apply?
yeah, a lot of times it's part of our cash assistance programs like AMFIP, Minnesota Family Investment Program. And as part of that, if the requirement is that they have to be looking for work or working, then sometimes we'll provide child care assistance.
That's a common theme, isn't it? Must be looking for work or working.
And then there's also sliding fee scale childcare that people can apply for, kind of working poor. There are people who maybe are participating in our food support program, or they just need the assistance to be able to have a subsidy to help with their childcare costs so that they stay employed.
Yes, yeah.
The vast majority of people who receive public assistance, they're working somewhere, and many of them are, they're working poor. Some of them are working more than one job, so the programs,
So
food support, medical assistance, child care assistance, they're intended to support those folks so that they can stay working.
right, and continue to advance their situation.
Yeah.
So there's child care assistance. We've talked about child support. And then direct financial assistance is the smallest piece.
Yeah, that's primarily the MFIP, or Minnesota Family Investment Program. It has its origination at the federal level with what's called TANF, or Temporary Aid to Needy Families.
Okay.
So,
But most of it, the biggest piece is health assistance.
right.
Let's leave economic assistance because we got a few minutes left, and we ought to give a little bit of summary about the Public Health Division. Now, who are they and how do they fit in, John? And I know they're not exactly what you're involved in, but let's try and cover Health and Human Services with a little talk about them.
Sure.
Okay? The Public Health Division, are they located here in downtown as well?
They are, they're in the same building, and
Okay.
it's a variety of different public health types of services. Home health care is one, kind of divided between our home health care types of programs and our family health care services and clinic.
Clinic, we have a clinic.
Yeah, it's a immunization clinic.
Does immunizations, okay.
Women's checks, children and teen checkups, those kinds of things.
What's,
or WIC
can
clinic.
anybody walk in? Do you have to be pre-qualified to use it? Is it
For some
income-based?
services, yeah, and some of them are tied to WIC, which is Women, Infants, and Children, I believe. We got a lot of acronyms.
Yeah, I know, that's anytime you get with the
Alphabet
government.
soup, yeah.
So, I'm just guessing then from what you've said that this would mainly be a clinic for people who are already in some other part of a program of assistance or services.
Sometimes. If they're involved with the WIC program and receiving WIC vouchers for, those tend to be, for formula for babies, baby food, whole grains, vegetables, those kinds of things. And you get WIC vouchers, and that's done through our public health, family health division.
Okay,
And-
so this is a public health division, so
Right.
they're giving out on some kind of a criteria, these vouchers.
Exactly.
Which then you can take to the clinic or other places?
Most of them, they would be getting those goods from grocery stores. So if somebody would have a WIC voucher for different things.
Like, over-the-counter medications or?
No, more the, like, formula, baby
Oh,
formula.
you're talking about baby formula and that sort of thing.
right,
Okay,
right.
Good.
And, they're very specific in the types of food. that are eligible for WIC.
Okay. So we've got a clinic, we got the WIC program, women, infant, and children nutrition. And you mentioned briefly home health care. Let's talk about that. How's that work? Who does that?
You know, as we were talking about adult services earlier, a lot of that tends to be in conjunction with those adult services. It's helping keep people in their homes, addressing some of their healthcare needs.
Yes, you were talking about keeping somebody in their home because of what a economic benefit it is to all of us, not to have them in a very expensive either hospital or some kind of other facility.
Yeah, so if you have, I don't know, somebody who is experiencing some issues with elderly, growing old, whatever, they may be able to stay in their home with minimal assistance, but they'll need that minimal assistance, and if they, you know, if the only alternative is like a nursing home or something, it's better for that person to stay in their home, and it's more economic for us as a community to make sure that that happens. So some of that is done in conjunction with our public health, nursing, and home health care.
So who's doing this? I mean, these are not volunteers. These are
No, they'd be public health nurses.
public health nurses. Okay, so these are nurses, qualified people, and they're going out to the homes of these people we're trying to assist stay as long as they can in their home, and they're doing blood pressure, take your medicine,
Foot
whatever,
care,
foot care,
You know, diabetes.
diabetes,
Just, you know,
testing.
right.
They can do testing in the home, I suppose, you know.
I'm not exactly sure.
I
the
know you
scope
don't.
of,
I know you don't do
health
this,
services, but I know
okay.
some of those kinds of things that.
I was just thinking what
Yeah.
they could do in the home. Good. We're talking about the public health division here, and
I don't think they do surgery.
okay. I'm relieved to hear
Yes,
that.
yeah.
They probably are as well.
Yeah.
Maternal and child health,
That's working with young babies. And,
visits to pregnant women.
Mhm, exactly.
And are these people already in a situation where they're involved in one of the other programs?
Some of them are, not all of them.
Not all of them?
Yeah.
What would be a situation where you could get involved in this program and not be in one of your other?
Probably immunizations, and again, I apologize. I'm not sure of all the eligibility
I'm making you
criteria
talk about things you don't.
But I don't think that just by virtue of involvement with public health services that you're somehow connected with some other
Okay,
service.
that's what I was trying to understand.
I'm
but
just not sure. of
The
specifics.
Public Health Division are providing some great services here, visits to pregnant women, infants, children, for assessment, education, support, and referral to community resources. So they're out there active in the community.
And they work in conjunction with other providers. So, you know, again, maternal and child health, say there's a person with a high-risk pregnancy that they're getting the kind of care they need, and referral to the people and services that can help them.
So we've been talking with John Pugleasa, the Economic Assistance Division Director. I've got him off of his home base, and he's done a great job of talking about the breadth of the County Health and Human Services. What we've been talking about are the different parts, the social services part, which were children's services and adult services. We talked about economic assistance, and then we talked a little bit about the Public Health Division. And if I got it right, John, these are the main components of the Health and Human Services. I guess what impressed me the most was the flexibility, the ability to apply from a lot of different kind of grants and programs, a lot of different types of service and assistance that could be. It wasn't one size fits all, but you guys can evaluate a case by case and decide how to keep the family together, how to protect the children, how to keep people working, how to keep people in their home when they're becoming elderly. Quite a great story, I think. What's the future look like? How does it work? Do you see things changing as the economic situation struck? Do you see, you know, what's the prognosis? What's your crystal ball say?
You know, I think what we see is kind of a pendulum effect from, you know, more, I don't know, conservative to more liberal types of programming that comes to us from, programming and funding that comes to us from either the federal or state government. And
You mean as the two main parties swing in and out of office?
part of that,
Or
but
just the
some
mood
of it,
changes
yeah,
in the
and some of
country,
it, some of it
or-
has to do with the economic realities. If there's,
Oh,
you know,
yeah, like we just went through.
right, and so there are those realities that impact the resources that are available, and also some of the programming that is established under statute. And so we saw definitely some program changes and funding changes as we came through the recession.
Okay.
And some of it is driven by those realities, some of it is driven by political realities, and so I guess crystal ball, I think Health and Human Services is always in transition. If anything, I'd say that it's in transition, and it changes more on an ongoing basis. And
So it's continuous change.
right,
The direction, the policies, the criteria. So it's constantly being tweaked as people try to spread the money
right.
in a different way,
And the
different
needs.
priorities.
The needs of the people accessing these services change
Now,
over
that's
time too.
interesting, and comment on a little bit of what that would be.
Well, maybe an example of that is the needs of people were different as they came through the recession as opposed to when,
Good. So more people might have like marginalized, lost their job,
Correct,
or
correct.
or they had to take a job at less pay, but they still got the same number of children to feed.
right,
and,
right. You know, and depending
Yeah, I
on
hadn't thought of that at
demographics,
all.
if you're in a community that is aging and demographically you see a higher percentage of elderly people, you're gonna have different types of needs with
Got
that.
it. Okay.
And if you see a younger population, then you have different kinds of needs that come with children and young families, and so needs aren't static either.
Very interesting.
And
So what about our community? I guess we have kind of an aging end and a young end as well. We're a very broad distribution. I'm just thinking.
Yeah.
So you're involved at both ends of this spectrum.
right,
You talked
know,
a lot about childcare, but you also talked about keeping people in their homes and the elderly.
you know, Beltrami County and Bemidji in particular is a regional center.
Yes.
And as a result, you see kind of a broader spectrum of opportunities, challenges, needs, resources, and, you know, as a result of healthcare that's available at a regional hospital, you'll see people who will locate close to those kinds of services.
Right.
And as a result, they're citizens of our county and maybe have certain needs. So a regional center may have a different level of need than, say, a remote rural county or a metropolitan county.
Gotta stop you right there because we're getting low on time. See, I
Sure.
told you we could talk
Yeah,
for a long
yeah.
time. This is a fascinating subject, and I'm really want to say on behalf of everybody, we're glad you guys are there. It sounds like you're doing an awful lot of programs and good work here in our county. Let me do a little sign off. Thanks for joining us tonight. I'm Lou Crenshaw, and we do this thanks to Upstream TV. Every Wednesday evening at 6:30, we call it Inside Bemidji, and we try to showcase people and organizations who are working to make our community an even better place. Tonight, we've been talking with John, the Economic Assistance Division Director of the County Health and Human Services. We've been talking about all of the broad programs that you guys are doing to make our county a better place. And John, I really appreciate you coming.
Yeah, thank you for the opportunity.
We're going to sign off, but there's a chance for the last word if there's anything that you'd like to say.
I'm grateful for the opportunity to talk about what we do. You know, we're proud of our work and proud of the people who work there. They care a lot about our community.
I think you should be. So with that, we'll wish you a good night, and we'll see you next Wednesday night at 6:30 on Inside Bemidji.